he had been researching colchicine.
Oh my God. He's found his weapon of choice and has committed.
Hey RX friends, thank you for joining us on another Pharmacy and True Crime episode. The series is where we travel down the dark side of medications and healthcare and ask ourselves, what can we learn from this horrific event and inform ourselves to be healthcare providers? So my name is Thu.
Hi everyone, this is Saley.
And we are so excited to have you join us today. Our topic today is going to be about colchicine and some of the more recent horrific poisoning that we have seen in the news lately. Saley, do you know much about this case?
Lord, no. And I am here today and just ready to get all up in the business because this is, I don't know. I think it's creative to me. I don't think of colchicine and poison in the same linear thought. I understand how it works. I know how we leverage it in all the different things I'm sure you'll talk about in a minute. Poisoning? No, man. That doesn't cross my mind. So I'm listening very attentively today because you're about to enlighten me.
Yeah. And I mean, so when I was thinking about the series Pharmacy and True Crime, I was not interested in covering just any crime.
Yeah.
My idea for this was always to provide a pharmacy and healthcare and clinical perspective on healthcare related fraud, for example, or any kind of crime that involves medications, because I think it's really important to share our pharmacy perspective in these cases so that people in the general population can understand what's happening.
Yeah.
But one of the things about true crime is that it can feel exploitative, which is a common criticism that a lot of true crime shows get.
Yeah.
And so for this particular show, I didn't want to exploit any situations or victim. And so when a friend of mine suggested this case, I was a little bit unsure about what I was gonna do with it.
Yeah.
But as I was reading more about this case, I really related to the victim, Betty Bowman, the victim of the story. And then I also became a lot more educated on colchicine. Like you said,
I can't wait.
Yeah, we use colchicine not a lot. Not a lot anymore.
It has very specific places in practice presently. And that's what I'm like very curious to know. And I think we talked about this. We both consume true crime, right? Like we both consume true crime as a genre of podcasting. And like you said, we were pretty much on the same page with what we wanted. And, we went through a series of corny titles. We're still working on titles, by the way. So if you have suggestions, hit us up. But we went through a couple of corny titles, like the pharmacology of it all, the pharmacology and true crime, because I really wanted to focus on, because when I listen to true crime podcasts, right, they mispronounce the drug names. They skip over completely how someone could have successfully pulled the murder off with the selected agent for the assault. They completely just fly over that. And that's when it started living in my head, like there's space here for pharmacy perspective to help educate the public. But this could also be a really cool and different way to get our P1s and P2s and new practitioners to learn a little bit more about the dangers of some of these drugs they see and work with all the time. So,
and now I totally agree. And now that after I've done all of this, I'm just a lot more vigilant when it comes to colchicine and everything that it can do. All right, well, let's just jump right into it. But actually, before we do that,
yes, please.
If you're watching on YouTube, please like the video, subscribe, and write in the comments of what other topics you'd like us to touch on, what other true crime related, healthcare related true crime episodes that you'd like to see. And if you're listening to us, please rate and write a review. Let the people know why we are the best companion when you are walking your dog or doing your dishes. Because, hey, we are your pharmacy friends. We are your besties, and we're here for you. Yes. So please join us.
Join us. This doesn't happen. This doesn't go forward. It does not grow without you, right? Like Thu and I get a lot of satisfaction and joy in knowing that the topics we do are things that you guys are guiding us and saying, hey, can y'all tackle this? Can y'all talk about this more or again? So the likes, the comment, the rating and review is how we become discoverable for other people that are interested in similar topics. So we appreciate the support always, but share us with your friends and families, please. And thank you.
All right,
I,
I want to give a shout out to my friend BT.
okay.
Her name's BT, and she's a pharmacy school classmate of mine, and she's an amazing human being. And she sent
Oh,
me this story. So
oh,
shout
thank
out,
you,
girl.
BT.
BT, hi. Hi to you and
Uh,
your family.
thank
um,
you for sending this our way. All right, girl,
yes.
kill the suspense.
Okay,
Hit
let's do
me,
this.
hit me.
Well, I know a little bit more information here, but for this episode, I got some of the information from different news article sources. One is from KTTC, a Fox News affiliate for Rochester, Minnesota, and CBS News article. Not gonna lie, some of these articles contradict each other so much, and this is why it is really important for
Oh,
me to step in as a pharmacist to break down some of these misconceptions out there.
period.
Exactly.
Period.
But do you know where I had to go to find some of the sources? I had to go into the District Court of Minnesota criminal complaint document, Betty's obituary, Connor's LinkedIn page, the Kansas Board of Pharmacy document to fact check everything. I
Investigative journalism. That's what that's called.
literally, literally.
You go, girl.
This is why I've got my glasses on. Everybody knows when I have my glasses on, it means that I've done a lot of research.
I I think we know that the glasses don't come out when it's just chit chat.
Yeah,
The glasses get whipped out when you're ready to get to
exactly.
business.
And by the way, Sele and I can be very goofy, silly people, but we don't want to take away from the seriousness of what had happened.
Yeah.
This is, in the past we've done true crimes or pharmacy and true crime shows, and it's, big stories of a lot of, they're big stories, but this
Yeah.
story is about one particular victim, and so we don't want to take that away from her. We may be kind of joking around because that's just kind of how we are, but
Yeah.
there is a lot of seriousness in this story, and we're
Yeah.
just
And
wanting
it's
to
not
dilute it a little bit so it's not so hard to digest.
100%. And most of what we're joking about is not about the victim. We're pharmacists.
Yeah.
And hearing that someone lost their lives secondary to a medication, that's never going to be funny.
No,
That's
no, yeah.
never,
We're going to
ever
take this
going to
very
be funny.
seriously.
Yeah.
Although I may try to, dig at the perpetrator, the alleged perpetrator, as much as possible because I truly despise this person. Anyways, let's just get into it.
Let's do it. Out there, I
So,
have your back.
Betty Bowman was a beautiful and intelligent woman. And, she seemed like someone that I would actually know in real life,
Oh,
especially the fact that she was a pharmacist. Did you know that?
I did not. One of us?
Yes, exactly. So Betty and her story is fascinating to me as both her
Oh
and I
my
have something in
God.
common. She was a pharmacist and she was yeah, to you too. And pharmacy is such a small world that I bet you I probably know somebody who knows
That
her.
knows
You
her.
know what I mean? Like
100%.
it's such a small world. So she graduated from the University of Kansas School of Pharmacy with a PharmD in 2017. Now, I don't want to sidetrack already, but this is one of those things that I have to dispel because in her obituary, which was written by her husband, by the way, it said that she graduated with a pharmaceutical doctorate in 2017. Have you ever heard of
Mm,
PharmD being referred to as a
no,
pharmaceutical
it's
doctorate?
a doctorate in pharmacy.
Yeah, we are doctors, or yeah, doctors in pharmacy.
Pharmacy. I
So
don't know.
I don't know why her
2017.
husband wrote pharmaceutical
Oh,
doctorate in 2017.
yeah.
And the reason why I bring this up is a lot of different news articles out there, especially I also listened to several podcasts about this too, and they're like, pharmaceutical doctorate, what is that? Like they couldn't
Oh,
really
they didn't actually.
comprehend
Yeah.
the fact that this is a PharmD and she's a pharmacist. They were very,
Yeah.
very confused about what she does and who she is and the significance of it.
Oh, we can
We'll
help them
talk.
out today.
Yeah, exactly.
We
Seriously.
can help them out today.
Invite us on your show so we can help
Yeah.
you. um, but we'll talk more about her husband in a minute, Connor Bowman. But I want to point out this very small detail because a lot of people they get confused when it comes to pharmacy and PharmD. But also, I feel like this is my first red flag with this dude. You don't know your wife's degree. Like what is wrong with you? Like get it together, So
Dude,
I'm already pissed.
I can
I'm
feel it.
already mad.
I can feel it.
Uh,
Oh my
Sally
God.
gets the brunt of like all of my reactions.
I just love it. I just love it so much.
Um, so here's the interesting part too is I think that this was where she met her husband actually in pharmacy school because Connor Bowman was also a pharmacist. He graduated with Betty. They were in the same pharmacy class. They graduated at the same time. And that's why that whole pharmaceutical doctor thing like blows my mind because yo, dude, you have a PharmD. Like
Okay.
what?
Okay.
You know what I
Um,
mean? Oh, okay.
um,
Sally's
um,
losing it.
I met my guy in pharmacy school. My
I
guy was my
know.
classmate. Henry, we need to have a conversation. I'm
You
scared.
you may need to send this to Henry after. Yeah. Yeah.
I may need to keep all four eyes on my fella. Literally,
All four. And the one in the back of your head too.
I don't want in the back of
Um,
my head. Oh, this
well,
is
although I mean
unfortunate.
here's the thing. I actually don't really know when they met because there was no confirmation, but they did go through together, through pharmacy school
Gotcha.
together. And then after pharmacy school, Betty went on to complete a residency at Stormont Vale Hospital in Topeka, Kansas in 2018. And
Wow.
unlike Betty, Connor actually went on to start med school immediately after graduating. So he goes on to do med school
Interesting.
while she does a residency. Um, on May 30th of 2021, they married, and then in the same year, they moved to Rochester, Minnesota, where Betty worked as a diligent and capable hospital pharmacist at the Mayo Clinic, while
Oh,
Connor began his internal medicine residency at the same facility. So they both worked at the Mayo
gotcha.
Clinic, which is a big deal. That's a
Yes,
significant
that's a
place. Mm-hmm.
that's a big place.
Mm-hmm. It's also important to note that when I was looking on his LinkedIn profile, Connor had also started working as a remote PRN poison control specialist at the University of Kansas Hospital starting in 2017. So, per his
Wow.
LinkedIn, it still says 2017 to present. So I think he just kind of works remotely, PRN, in addition to his internal medicine position as a resident, as a medical resident. So
President.
that's what's really interesting. And again, this whole thing is very confusing to a lot of people who've never been in healthcare because they were like,
Yeah.
Connor is a doctor, he works at the poison control, but then he's a pharmacist. Like they got really, really confused about that. So hopefully that breaks it down a little
It
bit
does.
easier for people.
It does.
So on the outside, Betty seemed to have a really beautiful, normal life, right? Like a caring husband. She also has this cute corgi named Sir Crumpet, second of Mulberry, which is what a name.
Oh,
Compared to Bear. What a name.
Sir Crumpet.
Yes, Sir Crumpet.
Uh,
And she obviously had a very successful career. People described
yeah.
her as loyal and caring, exceptionally thoughtful, and a kindred spirit. She was bright and outgoing. Her adventurous spirit took her around the globe to places like Yosemite, Hawaii, Iceland, Chicago, New York, Grand Canyon, so many places.
Oh, a
Um,
traveler.
she's a big traveler. Yeah, she seems to have a
Oh,
big, bright personality.
yeah.
And she enjoys spoiling Crumpet, and her obituary continues that she enjoyed spoiling Crumpet with unique doggy treats, toys, and outings
Oh,
to local parks. And she often spends her free time visiting local coffee shops, eating delicious cheeses, and spending quality time with her good friends. Which, reading that, I'm like, oh my gosh, I feel like that could be me, except for the cheese part. But like, I love coffee.
the cheese part and everything fits in
Oh,
for
there
me.
you go.
Like all
Right?
that fits in for me.
So,
Oh,
yeah,
she is every young woman that's a millennial. Like there's
basically.
nothing about her that does it that sounds already like I don't identify with her. I'm a
Yeah,
dog mom, have been for years. I spoil Louis rotten. You can't tell me anything, even though he's bad, but that's my baby. Don't come for us, right? And cheese and coffee, hanging out with friends, being ambitious and driven, accomplished in her career. This sounds like
totally.
us and a bunch of people we know.
Yeah, it sounds so relatable and
Yeah,
you just feel like you know this person.
absolutely.
But, you know, unfortunately, as many of these stories go, and underneath the calm surface lies a murky danger. And so from my own research, the suspicious behavior started August 10th of 2023. So this happened last year, you know, less than a year ago. Yeah.
Yes. This is current
Connor,
events.
mm-hmm, pretty much, yeah. So Connor had
Wow.
reportedly given Betty a smoothie on the 10th, but it had tasted so bad that she threw it out. Her and her friend even joked that Connor was trying to poison her. It was really important to also note that Connor making this smoothie in the first place was out of character because this man was not known to make anything for anybody, a source alleged. So that says a lot about his character as well. He does not seem like
Very
a
caring
caring, kind person. Yeah,
or nurturing, but suddenly he wants to make things
exactly.
for you.
Hmm.
Sus. Very sus.
Now, 5 days later, August 15th, Betty was supposed to hang out with a friend, but she later canceled to stay home with her husband because he surprised her with an alcoholic drink. The next day, Betty texted the same friend that she had been sick since 2 a.m. Later, she went to the emergency room saying she was so sick she could not walk. She reported that she thought it was a drink she had received that caused her illness because it was mixed in a large smoothie. So it was like he gave her another smoothie 5 days later.
Mm.
Yeah. She was admitted to the Mayo Clinic where she was transferred to the ICU. And when she didn't respond to standard treatment procedures, or I'm sorry, she was admitted to the Mayo Clinic where she was transferred to the ICU when she didn't respond to standard treatment procedures. Initially, friends and family were not worried as they assumed it was simply food poisoning. She was
Yeah.
young, she was healthy, she was going to be at the Mayo Clinic. Like, you don't think that
Oh
this was going
my.
to get any worse, right? Like, she was just going to improve and then go home. There's not much more information about what had happened during the hospital stay, but the criminal complaint document stated, quote, victim was admitted to a hospital in Rochester, Olmsted County, Minnesota on August 16th, 2023 with severe gastrointestinal distress and dehydration where her condition deteriorated rapidly. Her initial symptoms were similar to food poisoning and were treated as such. So, likely she was admitted. They gave her a bunch of fluids. They gave her,
Fluids.
yeah, fluids, you know,
Ah.
nausea medication, symptom management, probably something to help with her diarrhea. But as it has gotten worse, it sounds like, and you know, her vitals were probably worse. They probably sent her to the ICU. Um,
Oh man.
so she did not respond to standard medical procedures and continued to deteriorate rapidly. Victim experienced cardiac issues, fluid in her lungs, and eventual organ failure. Victim was taken for surgery to remove a portion of her colon after it was discovered it contained necrotic tissue, end quote. So she, I mean, when you say deteriorate, yeah, that's a pretty rapid deterioration from what you think would be a typical food poison, like a food poisoning situation, to necrotic tissue where she had to have her colon removed
But also too,
very
this
quickly.
is that's what I'm saying. That's what's like tripping me out. She goes from onset to necrotic tissues in hours.
It's very fast. Yeah.
This is bananas.
Yeah. So, and yeah, now you're giving me goosebumps because it is very, like, you don't see that very often. You know what I
That
mean? Like,
is
you don't see that in a hospital
fast.
setting where you come in with this condition that seems overall pretty benign initially. Very
Yeah,
young, healthy woman, and all of a sudden she's got necrotic tissue of the colon. Like, that's not normal. Yeah.
that's not, there is not, like, I'm trying to think of, no, that,
Yeah. Like maybe a
that
very,
is,
very severe case of C. diff. But I don't know how like
but
fast
even,
that can happen, you know, to like
yeah,
get to um
they
yeah.
come in with C. diff after it's been 3 days. For the last 4 days. Like they have been at home trying to
Right.
tough it
Yeah, they're
out.
like
They're like, but no, 7 times in one day, I can't. I can't deal with it. And
yeah.
oh, dude,
Yeah. It's scary.
this is so
So
frightening.
unfortunately on August 20th, which I guess 5 days after she had consumed the beverage. And then 4 days from admission, Betty Bowman passed away with cause of death still unclear at that time. Her husband seemed to be convinced that she was suffering from a rare autoimmune condition called HLH, which is hemophagocytic lymphohistiocytosis. That's a very big word.
Okay.
But he, for some reason, thought or was very suspicious of this very rare condition that all of a sudden just flared up in her body. Like apparently something triggered it all of a sudden. And so he even cited that as the cause of death in her obituary. So, quote, Betty J. Bowman passed away on Sunday, August 20th, 2023, at St. Mary's Hospital following a sudden onset of autoimmune and infectious illness, end quote. Like, what a freaking
Sir,
weirdo.
you're not a psychopath at all.
Yeah.
You're the worst version of psychopath there is.
Yeah.
And you're writing her obituary. Disturbing.
And they also say, one of the podcasts that I was listening to said that to include very specific indications for death like that in an obituary, that is apparently a red flag, allegedly.
That's odd, because you're trying to make a case. It's almost like you're trying to lend credibility to this hypothesis that you formulated. So you're going to restate it over and over and over again. Because you've convinced yourself of it. Now you have a job to convince every other sane person of your lie.
I mean, did he convince himself? No, but he is trying to convince other people.
People.
You're going to hear what a horrifically horrible human being he is. Tests were done for HLH, but they were inconclusive. So Connor's coworker reported that he was calm and stoic while everyone else seemed to be grieving appropriately. And, you know, that statement really, like, it made me think about the situation because she worked at the Mayo Clinic. She presented to the Mayo Clinic. Right. They treated her, sent her to the ICU, and she passed away at the Mayo Clinic. Yeah. Imagine if you're taking care of one of your own. You know what I mean? That must have been so traumatic to see somebody that you've known and you've worked with for so long just deteriorate like that. Like, quickly. I can't even imagine.
That's a different layer of, oh man,
right?
I don't know if I can, because even all the times where I've come into the ED where I work, everybody's just like super extra to make sure I'm good, I have what I need and everything. I can't imagine that if I ever deteriorated anywhere I worked, what that would be like for those people, you know?
It's a layer of like it's a personal layer, you know, and when a patient comes in and you don't really know them, of course you're going to give them the compassion that you would give anybody, but it's also really different when you know somebody that you're treating. Like, I worked at a hospital where one of the physicians that we work with was admitted, and like, you know, even if she wasn't like our favorite person ever or something, we would still give them, like, there's just something about the fact that you know them. You want to make sure that like they're going to be okay. Even a physician's wife, she was admitted to the hospital, and like we all kind of knew it. And so if, you know, we see him after rounds going to check on her, like we feel it for him. It's very, very interesting. So I can't even imagine what it's like to be at the Mayo Clinic.
These are secondary victims of this ordeal. No one would have walked away from that experience unchanged, you know?
So the next day after her death, the Southeast Minnesota Medical Examiner's Office contacted Rochester Police Department to report that Betty's death was suspicious in nature. They told police Connor contacted the office to halt the autopsy and push for Betty's immediate cremation, saying she didn't want to be a cadaver. He was also contacted one of the death investigators to inquire about the scope and timeline of toxicology analysis. The medical examiner's office had halted a cremation order after learning of possible suspicious circumstances. So thank goodness they halted that request to make sure they look into it a little bit more. So this is going to be a little bit even more disturbing information and details for you, especially as a healthcare provider. You know how creepy this could be. So buckle up. But here we go. So, upon further investigations, detectives found that from August 16th to 20th, Connor checked Betty's electronic health record during that time. Now, I believe that actually in one of the documents I saw that she did give him permission to look at her chart while she was admitted. Bowman looked at the admission information, reviewed the notes, medications, allergies, and an operation room log. From August 20th to the 23rd, after her death, they saw that Connor looked at Betty's chart daily, and on August 22nd, he modified her chart. He created a document encounter but did not add anything. Because he created the document, he was identified as part of Betty's care team, which allowed him to enter the medical record without entering his credentials. And then from August 23rd to 31st, way past her death, Connor looked at Betty's chart and viewing images, medications, notes, and other encounters. It's almost like he's returning to the scene of the crime over and over and over again. Isn't that so disturbing? Like, I would say sometimes if I'm taking care of a patient and I'm curious on how they're doing, I will probably look back just to kind of see, you know, what had happened to them. It's not really the best practice, but sometimes I want to see, like, did my recommendations lead to anything good or go anywhere? And it was almost like a learning experience for me. But for him to just like constantly going back and looking is, I don't know, like, and this isn't even like a patient that you're just like, oh, I wonder what happened to them. It's like, it's your wife. Like, I wouldn't
That's what
even
I'm saying.
want to touch it. Yeah.
Why do you want to? Because the other thing I also think is really important about this part and why this is so disturbing in nature is the way your providers talk to you and how your providers talk about you in your chart. The language, it's very, very different. They are more descriptive, more graphic, because these are legal documents and they have to detail things to a greater level of specificity that will never happen when they speak to you, because they know that not everyone is equipped to handle that, right? So when we're speaking to patients, we always calibrate our language to make sure that it's in a linguistically appropriate way when we deliver it, to minimize the blow of no matter how ugly it is what we're going to say. But if you sit down and you need to document a physical exam or document a patient visit or ICU rounds, those notes are very detailed and descriptive. So that's why I think that assessment that it was as if he was revisiting his crime over and over again is so accurate, because in those notes, he gets to know exactly the organ system failure and the sequence in which this was happening, because they time spent every assessment and discovery in her chart. This is sick.
Yeah, it's very disturbing. Like, if a family member of mine passed away, I would not be obsessing over it. I don't want to know. Yeah, I just want
to that
grief.
level.
Yeah, it's really disturbing. Okay, more disturbing information coming up, so get ready. But on September 29th, this is a little bit more than a month after her passing. September 29th, TK, a female fully identified in police reports who worked at the University of Kansas, contacted the detective because she had information that would be relevant to the case.
Let's go, baby. Let's go, baby.
Right?
Give it to me.
The university was able to locate internet searches conducted by Connor on their device and network. It seemed that Connor had worked at the Poison Control Center a week before the night of the incident and was busy researching colchicine. Colchicine is a drug that's used to treat gout, which is probably the most common indication, but it also has other indications as well. And interestingly, Connor had not received any calls regarding colchicine and no other employee received calls regarding colchicine that night or any of those days that he worked either. So why would he be searching for this?
And why would you be curious about colchicine? It's such an uninteresting drug.
It really is. Like, yeah, not interesting.
Such an uninteresting drug. Like,
but actually, hopefully, we can make it more interesting in this episode so that people can pay extra attention.
I'm just saying, if there's downtime at work, maybe I'm learning how to read EKGs more effectively. Like that's what, or like
No.
echo, like how to read echocardiograms beyond just EF, but the pressures interpreted. But why would you be searching this up at work during downtime?
You're not
Okay.
gonna find me reading EKGs on my
EKG.
downtime. Like that was literally one of my least favorite things ever to learn in pharmacy school. I'm like, why do I need to even learn this? Like,
Can someone just tell me what the irregularity
yeah.
is, and I got it from there?
You know, like when it's really funny when the doctors pull out the little
strip?
thing.
Yeah.
No, the strip of the little tool thing to like look at the individual, you know, like to actually measure out how long the different things are. And I'm like, ugh.
That's so cool.
That is kind of cool, but very nerdy.
Oh, you're counting the squares and the boxes? Like, I'm all up in the business, right? But
I mean, I do love it when they do get that interested in it, but I'm also like, oh my God. Okay. Can we just talk about the meds? Yeah.
Can someone tell me what the irregularity is?
Is it a STEMI or not? Seriously.
I am here to just know. STEMI or NSTEMI? Like, so I could tell you how this needs to go. I'm done.
Exactly. Okay. So anyways, let's get back to this. So remember that he had been researching colchicine. Connor also looked things up like internet browsing history. Can it be used for court? Also, he looked up police track package delivery and delete Amazon data police. Okay. I don't know if I would ever. All right. You know what they would find me searching these days? It'd be very, very embarrassing stuff. And I hope no one ever goes through my search engine, my search history. But not going to lie, I have this really bad, like a very unhealthy interest in celebrity gossip. And so you might find me looking up J-Lo, Ben Affleck. Are they getting a divorce?
I need to know. This is very important information for me.
Yeah, seriously.
That's hilarious. Just like, that's all they'll find there.
Yeah, I mean, yeah, that's all you're gonna find, police officers. So please don't even bother. Don't bother. Yeah.
Let me save you the time.
All right, back to this ridiculous human. These searches occurred on August 5th, 2023. Later, on that same day, August 5th, which is, by the way, 10 days before the incident, Connor was also searching sodium nitrate and even Google shop page for various vendors selling sodium nitrate, which I didn't do too much research on sodium nitrate. Sorry, everybody. But, if you decided to look it up, could you please let us know what you find about that? Okay. On August 10th, he searched food versus industrial grade sodium nitrate. And I want to remind everybody that August 10th was when he gave Betty that first smoothie that she threw out. So I almost feel like he initially tried to do something with that. And because it didn't taste very good, or he found that it probably wasn't as effective or something, he kind of decided to pivot. He then accessed a medical journal that this specific journal is used for medical professionals to search on information regarding the lethality of substances. On the same day, Connor was converting Betty's weight from pounds to kilograms and multiplying it by 0.8.
And we know what 0.8.
And 0.8 milligrams per kilogram is considered the lethal dosage of colchicine.
Colchicine.
Yeah. So, not great. The data was also revealing that he went to a GoodRx website and he searched for liquid colchicine. The search for liquid colchicine continued to the next day.
Oh my God. At this point, he's found his weapon of choice and has committed.
Yeah. Like converted her weight, is multiplying, finding the right lethal dose. Like, imagine doing all of that. What kind of person do you have to be to take those steps? This is not just like, oh, I'm just going to give her this. Like, you have to calculate, do all of this research, figure it out. Like, it's very, very disturbing to go through all of these steps. I'm so disturbed by this. Like, this freaking human being is like, Anyway, so the Department of Health provided initial toxicology results, which showed that colchicine was present in Betty's blood and urine. Samples of Betty's blood from her admission on August 16th detected colchicine. Her medical records show that she was not prescribed colchicine, nor was she given any in the hospital. So she shouldn't have any colchicine in her system at all, basically.
She's a healthy young woman that likes to go out for coffee and
Yeah.
cheese. So no, there
No.
is no heart condition or any pericarditis or gout issues. Otherwise,
Yeah.
someone would have told her stay away from that cheese stuff.
Right.
But there's,
No.
I'm not surprised. She had
Yeah.
no indication for it.
No indication. It was also known that Connor had been in significant debt and was desperate. And had a separate bank account from his wife. Connor's coworker learned that he retained a lawyer and had just received Betty's $450,000 in life support insurance payout. 3 days after Betty's death, a friend told investigators she went to visit Connor at his house. She noticed that the photos of Betty had been taken down and Connor was there with another woman. Now, I don't want to dive into the relationship issues and things like that, but there are a lot of a lot of articles detailing the romantic troubles between the two, so you guys can definitely do your own research there. But
I want to dive into it. I wish to God Henry would. My sister has very strict instructions. You come up here and you wreak havoc. He is not allowed to have another woman in this house. So I'm just kidding. But I'm just saying, like,
yeah.
already?
No. Mm-hmm.
Okay.
Yeah.
Continue.
So that's honestly pretty much all of the details pertaining to this case that I wanted to report. And it's already disturbing enough. One thing that I'm just like so weirded out by is the fact that this person was a pharmacist. He had a PharmD, and then he's becoming a doctor, like a physician. Like this this psychopath is going to apparently take care of people. The other thing too is like, I mean, obviously, I don't want to spoil it or whatever, but he was arrested and all of that, and I'll talk more about it later. But I'm also just thinking like this is also a perfect example of what it's like to be extremely book smart, but then extremely a dumbass. Like a piece of like I don't want to cuss too much on this episode. It's not like we're
Exhibit
but like
A.
if I could, I would like cuss him out. Like he is so stupid. Like I can't even. So, anyways.
Oh my gosh.
Yeah. What do you think about this case so far?
I'm blown away by so many different things. So the sodium nitrate situation, I think that's the substance. Please fact check me. If you know me, you know I don't care about being redirected. If what I'm about to say is wrong, please fact check. But sodium nitrate is that substance that exists in things like beef jerky and stuff like that.
Yeah.
And I know that a lot of countries have banned it. And I know that it's been linked to like development of like chronic diseases, diabetes being like one of the leading things that it caused. Like when I read a blurb about why these countries were all banning it, I'm wondering like if he started with that and realized that that's going to take too long to kill her. He wanted something that was going to kill her much faster. Because I'm just sitting here thinking like, what would have made him abandon the sodium nitrate and go with colchicine? The sequence of
events. But I also feel like, when he gave her that first smoothie, she threw it out. Like she couldn't,
right?
Yeah. And I think if you give somebody enough sodium nitrate, maybe it will do something, but the taste is so significant that nobody would consume it.
Exactly.
And I think that's probably why he decided to switch and try something else.
I'm going to look into this because I'm really curious. I think he was ready and done and wanted her out of the picture and just wanted something that would be quick. But that doesn't sound quick because it sounds like it was 4 days of agony. If there was necrotic tissue in her body found in a matter of hours, that could not have been anything quick and painless.
Yeah.
And nobody, I don't care what the circumstances are, nobody deserves that.
Nobody. Yeah. Well, I'm really glad that this is a really great segue into the actual mechanism of colchicine itself. So when we come back, we're going to talk about what is colchicine and how did it lead to this horrific experience.
Experience for Betty. Okay, cool.
All right, we'll be back.
I am so mad. Oh, sorry. Yeah, go ahead. I'm just so mad. Like,
and we're back.
Stop. Like, this guy's sick.
Yeah, he's disgusting. Like,
oh my God.
I have no, like, it's like I have so much love for Betty, and then for Connor, this disgusting human being who's also a pharmacist and a doctor. Like, we do not own him. Like, we disown him. He's a disgusting human being. Yeah. Like that. I can't. It's like hard for me to describe how much like hatred I have for somebody. It's just so ridiculous. But welcome back, everybody, to this next part of our episode where we dive right into colchicine and what it does. And so colchicine is an alkaloid which was originally extracted from bulbs of a plant. And the plant is called Colchicine autumnale, a meadow saffron, apparently.
Yeah.
It was first recommended for the treatment of gout by Alexander of Tralles in the 6th century AD. So this medication is hella old, okay? It's very old.
16th century, it's older than modern pharmacy.
Yeah, it's a very ancient medication that's been used for many, many years. That's like years.
You go, colchicine, for surviving.
Seriously, it stays relevant. No. It has been FDA approved for gout prophylaxis and familial Mediterranean fever. Colchicine has also been found to be safe in established therapeutic dosage. However, drug interactions, particularly with CYP3A4 and P-glycoprotein inhibitors, can cause the drug levels to rise in the body, leading to increased risk of side effects and toxicity. Oh. Patients with impaired renal and hepatic function are also at risk for toxicity as medication is metabolized in the liver and excreted by the kidneys. Oh. Here are some clinical pearls for those who are listening. When reviewing colchicine orders, always review the indication. Obviously, that's the big one. Please. That's the first thing you do.
Please.
Just like, oh, colchicine, cool. Yeah. Pass. Like, no, we should probably see what it's for and what it's about. Renal function and liver function. So the kidneys and the liver. We always want to check for drug interactions, and we want to check for the dose. The dose should be adjusted based on kidney function, and concomitant use with a P-glycoprotein and strong CYP3A4 inhibitor is contraindicated in patients with renal or hepatic failure. So medications that can inhibit both the P-glycoprotein and a strong inhibitor of the CYP3A4 enzyme, things like ketoconazole, clarithromycin, those are contraindicated in patients with already kidneys or hepatic issues. Yep. So always pay attention to those contraindications and drug interactions.
Right. And what we are talking about is
the most basic
of drug interactions, right? Like majority of drug interaction is 3A4. These are not uncommon drugs. Like we're talking about commonly used azoles. And if patients have gout, commonly used azoles in elderly patient populations who also have what? Renal dysfunction. So if you see colchicine, pause, take a minute.
It's a big red flag.
Yeah, it's a ring flag. Take your time and process it through. Don't just blow through it because you've seen it 10,000 times.
I mean, it is really, sometimes it is a kind of a difficult thing. Like colchicine is not always necessarily like first line for most patients, because especially in older patients, we see like the renal failure and we see all these other, polypharmacy, a lot of medications that can cause interactions. But sometimes we can't really use medications like NSAIDs because of the renal failure. And then sometimes we don't want to, exactly. Like for Saley, for example, like, what would be a good option for her? Lots of drug interactions, I'm sure. And also, we don't always want to use steroids in people if we can help it as well. So it's sometimes we do kind of have to rely on colchicine and dosing it properly and making sure that we double check for everything else.
100%.
Now, here's the thing. I don't have the brain capacity to go down into biochemistry, and bless you if you're taking those classes right now. I do not envy you at all. Although I did almost become molecular and cellular biologist. That was my path. Yeah, did you know that I was going to become a molecular and cellular biologist? That was
Somehow
my
I think
major.
you would have killed it still. I
I
just
think I
think
would have
you,
been miserable, honestly. I
no,
hated I really don't like lab work that much. And
no
I feel like it's going
way.
to require a lot of research. Like I am not, I don't, I'm, I'm blessed to be a pharmacist because I don't really care that much about like tiny things. Like I like to see things in big picture. And
Big.
so I'm really glad that I get to do that like in a clinical setting.
I know you
Um,
say that a lot. That should be a tagline. Hashtag I am blessed to be a pharmacist.
exactly.
That
I'm
is
blessed to be a
that is
pharmacist.
Stu's tagline. Every time she's gonna get into something, she just wants to make sure we all understand how much she loves her role as a
That's
pharmacist.
true. Don't
I
get it
love it.
twisted.
I love it.
um,
I love it.
But but let's to understand how colchicine work, let's make ourselves super tiny and go into a cell.
Oh
So
boy.
colchicine binds to, okay, let's get into some biochemistry here. Colchicine binds to a intracellular protein called tubulin, and that then prevents the formation of microtubules. And if you
Oh,
need a reminder, which I needed a reminder,
yes.
microtubules are involved not only with cell division, but also signal transduction, regulation of gene expression, migration, and secretion. So microtubules does
Oh,
actually prevent cells from moving around, which our cells in our bodies move around quite a bit. And
yes.
so imagine being on colchicine and your cells pretty much are frozen.
Yeah.
It's not
No
functioning very
signal.
well.
Yeah, like the no signal transduction component of it is frightening enough because everything in the body is based on signaling.
Yeah, it's very scary. So, how
Oh,
colchicine became known as an anti inflammatory agent is on its effects on the leukocytes, also known as the white blood cells found to fight infections and other diseases. So, colchicine has an inhibitory effect on several leukocyte functions, and the most potent one is leukocyte chemotaxis, which is the movement of leukocytes from blood to tissue in response to an inflammatory stimuli.
yep.
So in gout, for example, the monosodium urate crystals are formed in certain joints, leading to a danger signal to the immune system. The immune
Mhm.
system is now signaled to migrate to those sites.
Yep.
And then that causes even a bigger inflammation. And that's where you see all that pain and like the
Pain,
swollen joints and
swelling,
the swollen
and it's
toes.
red.
Very painful.
Yeah.
Exactly, yeah. So
Yeah.
our leukocytes and macrophages begin to infiltrate these affected sites and eventually cause more inflammation. They release all sorts of all sorts of crap.
Stuff. Also, it's a very fancy stuff.
Yeah, stuff.
I love this. I love how we're explaining but not
Yeah.
explaining.
Yeah, you don't need to know the details. You just need to know
Mm.
that it's there and it's
Just
causing
know
problems.
that the body decided Avengers assemble.
Yeah. Yeah, imagine a Marvel movie playing
Yeah.
in your joint right now.
Yeah.
The microtubule disruption of colchicine have been known to intervene in these underlying gout inflammation, although there seems to be other mechanisms of action specific to gout flares.
Wow.
Colchicine is available in an oral form, which is a capsule, tablet, or solution. And it used to be available in an IV form, but that was removed from the market by the FDA in 2008, I believe, due to serious adverse effects.
Gotcha.
So the dosing for gout attack is typically 1.2 milligram loading dose, which is the loading dose is to kind of boost, your drug levels so that the drug can kind of get to steady state faster. And then zero point 0.6 milligrams 1 hour later, followed by zero point 0.6 milligrams twice a day until the flare resolves.
Mhm.
Colchicine doses of a highly toxic levels of colchicine is zero point 0.5 milligrams to zero point 0.8 milligrams per kilograms, and more than zero point 0.8 milligrams per kilograms are typically lethal. So if you think about how much Connor probably gave Betty, it was
Yeah.
probably 40 times what you would give to somebody normally receiving this medication. So normally we do zero point 0.2 milligrams of medication loading. That's like the biggest dose that you would give
Right.
anybody.
Yeah.
Connor probably gave her like 40 milligrams of colchicine. Like it's disgusting. Can you imagine like measuring it out and putting it in that fucking smoothie? Like seriously,
I was waiting for when you were gonna just go
I'm so
let one loose.
upset. He's disturbing. Like he's so
When you were
disgusting.
when you were just gonna let one loose. I'm trying to think of the motion, right? Like what you're
That's what
thinking
I'm
is like, yeah,
saying.
I'm going to order it. It has arrived. I'm going to
Yes.
open it. I'm going to conceal it. I'm going to put it in something she's going to ingest. And then I'm going to work up the courage to actually give it to her. Then I'm going to sit there and watch her ingest it. Bruh, you are
Dude,
sick. You are the sickest version of sick.
disgusting. Yeah. There is no word to describe someone like that. Like, I can't think of the word. I just know that he is the scum of the scum of the scum. Like, it's
Dumpster juice.
disgusting.
Dumpster juice. You are garbage dumpster
Ugh.
juice.
Like,
Just,
makes me kind of nauseous even thinking about all the steps that you just listed.
yeah, because
Right? Like,
it's what I think about. At every
ugh.
one of those junctures, you had an opportunity to stop. You had an opportunity to give it to her, and when she tasted it, it's like, oh, this tastes funny. Oh, does it? Let me remake it.
Yeah.
You had
Oh,
a chance
I'm
to
so
stop
disturbed.
yourself. And when
Like,
you brought
and
her to the hospital,
he is a healthcare provider.
yeah.
You
So
know
this
what
is
I
like
mean? And that is the
well informed,
really weird disconnect. Like, honestly,
well
like,
informed decision making. There was no, I didn't think
yeah,
it would turn out that way. No, sir. You knew exactly how it would turn out because
yeah,
you have multiple trainings, PharmD and medical training. You knew exactly how it would turn out. There was nothing like, oh, I just pushed her a little, then she tumbled down the stairs. I didn't realize I pushed her that hard.
yeah,
That's not what we're talking about here. You knew the force you wanted to use. You researched the weapon you wanted to use. When you made a decision, you committed all the way through.
mm-hmm.
I'm done.
So, so imagine Betty drinking the 40 milligrams plus of colchicine all at once, right? And now here's the stages that her body
Went
goes
through.
through, and it's horrific. So the course of colchicine intoxication can be divided into 3 stages with overlap between the stages. The first stage is always gastrointestinal symptoms. Usually, it's
Yeah.
nausea, vomiting, diarrhea, abdominal discomfort. A lot of times, you're losing quite a bit of fluid, and you also may have a high white count.
Yeah.
And there's excessive fluid loss here. And that's why when she goes into the Mayo Clinic, they probably treated her for, your basic food poisoning.
Yeah.
Now, this stage is from 0 to 24-hour post ingestion. So that really lines up with her symptom and how she presented. The second stage can be seen from day 1 to day 7 post ingestion. This is the multi-organ failure phase. And this is, just so upsetting and depressing. A lot of it is respiratory distress syndrome. I mean, she did have fluid in her lungs.
Nice.
Um, yeah, renal failure, bone marrow failure, other things like encephalopathy, cardiac arrhythmia, which they did mention she
Ah,
did have some cardiac issues.
yeah.
Just basically, massive, massive multi-organ failure just all at once.
Failure.
And imagine like taking a medication like colchicine, where if you take a big enough dose, it affects all sorts of cells in your
Everything.
body.
Yes.
Your body is just not like, and literally your body is just not functioning normally. Like, all of
At
your
all.
organs can't do anything. It's
Yeah.
none of
Well,
its normal
they're not
function is
even,
working.
yeah, they're not even communicating with each other. Like, that's why I say, like, the
Yeah.
moment you said signal transduction, I'm like, okay, well, you're set up for failure from jump because without the signal from the brain to the diaphragm to contract, and then the neurotransmitters that get released and the signals that sent to different organs, waste more fluid, no, hold on to more
Yeah.
electrolyte.
Yeah.
Everything is about signaling. So
Mm-hmm.
if you effectively mess with that, of course there's multiple organ system that sets in quickly.
Mm-hmm. So
Oh,
death from acute colchicine poisoning is usually due to hemodynamic collapse and
yeah.
cardiac arrhythmias, or from infectious or hemorrhagic complications.
Oh, yeah.
Um, Now, if
Bone marrow
the
failure.
bone marrow failure, now, if our patient does make it past this second phase, this is the surviving stage, where this is the third stage and is characterized by bone marrow recovery. You do see some rebound leukocytosis, which is elevated white count,
Yeah.
but you also see resolution of organ failure, and you may see regrowth of hair, because you do lose hair in some of the stages
Yep.
of it. And it's really fascinating because colchicine poisoning, the reason why it's so dangerous, first of all, I should mention that there really isn't any specific treatment for colchicine poisoning. The
That was
clinical
my question
management
for you.
Yeah, the
I,
clinical management of colchicine intoxication includes early gastrointestinal decontamination and aggressive
wow.
supportive care. So, if you
Yeah.
know that a patient has taken colchicine and has taken too high of a dose and now they're showing up with all these symptoms, you may want to even pump their stomach. So, remove the remaining colchicine from GI tract, or you can use activated charcoal as well.
Yeah.
Attempts should be made even if it's later in the presentation
Yeah.
because they have found that there's still some colchicine left 24 hours after ingestion. So you can still try
Unbelievable.
to do as much as you can, whether it
Unbelievable.
be early presentation or later presentation. Unfortunately, I don't think for Betty, colchicine poisoning was not part of the differential diagnosis, and that's
No.
the dangerous part. Is
Yeah,
that
well, also her murderer was the person who accompanied her, and she's ill. She's probably not even able to participate in her own care as much because she's deteriorating so
yeah,
quickly.
you're right.
I've been there where my sister, I have to rely on her to give all of the best information she can. So keeping her informed about what's changed was it's important because I've been sick to the point where I cannot participate, right? But if you're accompanied by your murderer, the person who's supposed to participate in your care on your behalf, they are
Yeah.
literally there with one goal on how to
Yeah.
not help
Hmm.
in your care.
I
Another
mean,
point, he could have stopped. Another point,
yeah.
he could have said, you know what? I messed up. I need help. But
Like maybe he could have been like, you know what, I that smoothie, I was kind of like unsure about it too because I didn't feel, like he could have lied maybe about it and be like,
yeah,
maybe we should pump her stomach, maybe we should
yeah,
give activated charcoal, something.
could have
And
been vague.
especially the fact that he was like a medical intern, they probably would have paid attention more to his potential,
A
recommendation. But
hundred percent.
yeah, it's
A
very disturbing.
hundred
And,
percent.
that just reminds me too of like if he did present with her and I'm like, oh, I work at this hospital too, a medical intern, like everybody's going to trust everything you say. Nobody's going to
Credibility.
have a red flag about you at all. You know what I
Yep.
mean? So nobody was going to be like, did something happen? Like people would just trust you because you're a doctor. um, all right. So yeah, but that is the disturbing part is that I don't think it, unfortunately it was not part of her differential diagnosis when she showed up. So of course nobody was gonna try to
Nobody.
contaminate or anything. And in general, there is no specific treatment. I guess in one single case, they did use a fragment of anti-colchicine antibody in a patient, which was successful. It was actually these
Oh,
antibodies racing goats have been found to be effective, but unfortunately are not available. And I don't quite know why they're not available. It still seems like they're not available now to this day. And when I was researching it, but it may just be like it's not a common enough thing. It's too expensive to
yeah.
research and to make.
Goodness.
But considering how dangerous this medication could be, I think it's worthwhile to at least have something available because it seemed
Yeah.
like these antibodies really worked quickly to
Wow.
resolve a lot of these symptoms.
Dear up and coming research and scientists, if you're in a position to start a biotech company, this may be something worth being the only company in America that provides it. And I hope that no one needs you, but we'd be
Just in
really
case.
glad to know that you're in the middle of nowhere and we can get something overnighted to our hospital for somebody that has been exposed to this really awful, awful medication
Hmm.
to hurt them. And so, future biotech geniuses,
Can you
there's an
imagine
opportunity.
if someone messaged us like 20 years from now and they're like, it's
Yeah,
because of your podcast that I created this product. I listened to your podcast and it was so compelling and
I'm I'm literally gonna make it the header of my CV
right?
because of HRX HRX Friends podcast. No one dies from colchicine poisoning anymore.
Ever again. Yeah.
From now on, call me hero. Nothing less will do. Nothing else will do.
Yep. Call me hero.
Call me hero.
Oh, that's amazing. So, yeah, so that's unfortunately, you know, unfortunately with colchicine, if you don't catch it soon enough, and even if you do catch it soon enough, it may not be effective just because there's no specific antidote for it at
Yeah.
this time. Now, to kind of close the loop on everything. Authorities did arrest Connor Bowman on October 20th and charged him with second-degree murder, which is
Second
what,
degree.
two months after her death. Yeah. So a person
I,
intentionally or knowingly unalive another person without premeditation, which is very odd
but
because they do seem
that's
to have quite a bit of,
That's what I'm
yeah.
saying. The question I'm asking about why second and not first, the biggest differentiator between first and second degree is the premeditation.
Yeah.
You cannot tell me that as a district attorney, you're going to have a difficult time convincing a jury that planning went into picking the weapon of choice.
Mm-hmm. All right, so it looks like we do have an update. This article that I found was written on June 7th, 2024, and the article states, Connor Fitzgerald Bowman, 31, is charged with first-degree murder and second-degree murder for the death of Betty Bowman. Investigators say Connor Bowman poisoned his wife with a drug called colchicine, leading to her death in August 2023. Bowman's lawyers have now filed 12 motions to suppress evidence against him collected by law enforcement and a 13th motion to have the grand jury indictment against him dismissed. The 12 suppression motions attack the warrants used to authorize the search and collection of evidence from Connor Bowman's home, vehicle, iPhone, Mayo Clinic records, University of Kansas hospital records, records from online pharmaceutical distributor, a U.S. bank mailbox, and various other items. Bowman's lawyers say the warrants were defective in many ways, including failing to connect the searches to any criminal activity, failing to establish probable cause, failing to impose any time limits on searches, violating medical privileges, violating the Minnesota Health Records Act, giving law enforcement unbridled discretion and allowing exploratory rummaging, using catch-all phrases that were insufficient particular. The defense attorney says all of these defects taken as a whole cast significant doubt upon the integrity of the indictment and the state's presentation of evidence to the grand jury. The motions were filed Thursday, so I think it was very recently filed in June of 2024, and a hearing on them has not yet been scheduled. Oh my gosh. Well, I mean, this is not necessarily an update that I want to make, and I really do hope, at the end of the day, justice for Betty, that we capture the right criminals and we put them where they need to go. That's very vague, but, that's all I can really hope for. Okay. That's it. Yeah.
This
required a lot of research, a lot of planning. You don't just get colchicine from, over the counter. Like you had to
He's at work
do
looking
all
it up.
sorts of stuff. Yeah. Which, I have no idea how he even got the colchicine. I don't know, because he's a doctor. Right? He has prescription authority. Access. Did he write himself a prescription? That's very, that detail was never stated in any of the documents I saw, but it's just, it's very disturbing.
Great questions. Very great questions.
Now, interestingly also, he was fired from the university. I mean, not interestingly, but he was also fired from the University of Kansas on October 23rd, and his PharmD was suspended. And I even saw the documentation on the Kansas Board of Pharmacy. I don't really know what happened to his medical license, though. I couldn't find anything, but Connor Bowman remains in jail on a $5 million bond. So yes. I hope he
Yes, Judge. $5 million. Yes, Judge.
Yeah, that man is not allowed out. And it's just but that's what I'm, just reading this part, I'm like, I just don't understand how someone can go from okay, I am not happy in my relationship or in my marriage. I have all this debt. Oh, I know. I'm just going to unalive my wife and get her life insurance. How do you go from oh yeah, I'm so smart, I have all this degree and accolades or whatever, and then think about doing something that is but what is going to happen if someone catches you? I think what it is he probably just didn't think that anybody would catch him. I imagine.
He's smart enough. He's smart enough.
Dumbass.
Right? He's smart enough. In his mind, he's smart and brilliant enough and has been able to outsmart everyone probably all his life. What would make him if he made an objective assessment of his life, he's outsmarted people all his life. What would make murder any different?
But what? I just don't understand.
I don't understand it, but And this, my fascination with true crime is this part, the dissection of the motive, the why. And what is that decision making process like? And that's why, like, when people commit certain murders, like, and as I'm listening to the recount of some of it, that's what I'm thinking about. Poisoning is a very specific type of crime to me that is just next level evil. Like, it takes planning, tremendous planning. And when you think about how advanced science is today and how things are discoverable, poisoning continues to be these things that we just find out after the fact. After the fact. And someone has to have the sense to be triggered to say, can we check for this? Can we check for that? Right? But poisoning people, drugging people, these things continue to be very effective modes of either gaining control over people by inebriating them, and they don't have the capability to consent willingly or have a voice in what happens to them and their body, and straight up killing them.
Yeah, I
It
didn't even
takes,
think about that.
right, it takes a lot of planning and meticulous planning to do it. And I am deathly afraid of it, but it deserves very, very rigorous
Yeah.
interrogation and processes in our emergency rooms for when people come in and they it's just things are going down a hill too quickly.
Mm-hmm.
Let's not be afraid to think of the worst. Please
Mm-hmm. Yeah.
think of the worst. Because if someone
Seriously.
thought of the worst, they would have thought of tox screen. But also, is colchicine on anybody's tox screen as a standing? Nope.
I mean, it's really interesting because when I was doing this episode, I was like, oh, do I want to like release all this information for everybody to know like what is the lethal dose or whatever? But I'm like, it's readily available. You can just Google it.
You can
And
Google
so
it.
anybody can Google this,
Yeah.
and anybody can really do this. And I think that now that we are more aware of
Yeah.
how this medication can be used, I think we're just gonna need to be more vigilant about that. But just in general, also when we're giving people colchicine, we should also be aware of like what this medication actually does and how harmful
Yeah.
it can be to the
Uh-huh.
body,
Mm-hmm.
and how dangerous this medication can be. So there are case reports out there with patients on therapeutic doses that can experience these types of symptoms. So
Symptoms.
GI related symptoms, gastrointestinal related symptoms. If you
Yeah.
see that a patient's on colchicine, you may want to think twice.
Call
You
a
may want to
timeout.
hold it. Yeah. Figure
You may
out
want
a
to call a
different option.
timeout. And
Yeah.
also, right, you covered all of these drug disease interactions. You're having GI issues that's coupled, but also GI issues present, but it's not just that in isolation or in the silo.
Mm-hmm.
Put that in a shadow of, yeah, patients having worsening renal function, or patient is having beginning signs of liver failure. You could be exacerbating a drug toxicity here because we have levels above therapeutic levels or drugs hanging around
Yeah.
longer than we want. I'm teaching drug interactions in like a few weeks. I'm going to insert Betty's story, and I'm going to give
Oh my
Betty
gosh.
homage in class and
Yeah.
teach people about, we don't, your drug interaction model, it's not just to be cute, but understanding and recognizing when your patients are experiencing toxicity because too many things are in the same bowl. Very important, because
Mm,
you as a
yeah.
pharmacist can step in and say, have we considered this?
Mm-hmm.
Sometimes it just takes a question for people to say, oh,
Yeah.
no, we have not.
Yeah.
No, we have not.
But that's also the interesting thing too. I saw in this article here, which I did also print it out and highlighted. Haha. But it does say chronic toxicity is thought to be rare because development of gastrointestinal symptoms usually lead to stopping treatment. So a lot of
Yeah.
times you'll
So we're
see
doing
more
good
of
with
an
that
acute.
part.
But
That's reassuring.
hopefully that this episode can give us more information on this medication and we can be more
Yeah.
vigilant about dangerous medications out there because, listen, medications can be harmful. I think the other day we were just talking about medications and people blaming things on medications, and you're like, I hate it when people blame, side
I
effects on
you remember that?
medications. And I'm like, I blame medications for things all the time.
we were
Medications are
talking via
dangerous.
text, right? And I was like,
Yeah.
I take it so personally every time people are like, it's the drugs.
It's the
Even though
drugs.
in
Yeah.
my head, my first stop is, let me look at this drug list. And
Yeah. It's probably the
for
drugs.
always looking for like ugly, big offenders. Is there an azole? Is there a seizure med? Is
Right.
there like, I'm always thinking of like, I have this list in my head of like, if I see rifampin, it's like, pause. Like,
Yeah.
let me take a look because I know of how ugly it is with drug interactions, right? But I'm always taking it personally when someone else points it out. Like, hey, you're not from the pharmacy department. Like, this is none of your business. You
Ah!
don't have
Yeah.
like, and
Doctors
then
are
you
like,
are like, I always go and blame
yeah.
the drug.
I always look at the drugs first. I'm like, but yeah, I mean,
It's always one
as
of your own. It's always one of your own.
I'm just saying though, like I think medications are so scary. And like I think a
Very.
lot of people have this misconception that pharmacists like medications, that we enjoy dealing with medications, you know what I mean? And I'm like, actually, on the contrary,
Yeah.
when I see medications, I think of all the worst case scenarios that can
Yes.
happen with this therapy. And then
Yes.
I decide whether it's safe enough for this patient, like the benefit outweighs the risk for a
Yes.
patient.
Always.
So, you know what?
It's a
Sometimes.
misconception. We could do a whole misconception about pharmacy
Mm.
episode.
Oh my gosh, what if people send in like misconceptions for us to break down and like
Yes.
for us to teach the
Poll
world?
coming. There's a poll coming your way on
Oh,
Instagram. There's a poll
that's
coming
right.
your way. Major
That
misconceptions
is
about
right. Oh,
pharmacy.
how fun. Okay,
Yeah.
well, I love it. Well, that is it for today's episode. Thank you so much, everybody, for watching. I've got the chat box open. Hopefully, you've got yours.
I do.
Okay,
Can we take a minute
sure.
to get her back?
Oh, sorry. I thought you meant like an actual pause. Oh, yeah. Can we?
This
Okay,
is,
I
why,
love it.
this is why, like, if we ever release this behind the scenes stuff, they'll never believe that what they listen to, this is what happens in the process.
Yeah,
Give
let's
Betty her
do.
power back
Yeah.
and use her name in a way that is different from how her life ended. But it just sounds like Betty was a badass. She was driven. She was accomplishing. She was going really far places.
Yeah.
She loved her friends. It sounded like her friend time was very important to her. And it sounds like she loved, period, and
Yeah.
ended up with a monster.
Yeah.
But how she lived her life, I think I'm respectful of it. I admire it. And you are me, Betty. My guy's from pharmacy school too. And I am so sorry that this is how her stories ended. But as a fellow pharmacist, I admire the drive and the success she was able to accomplish while she was here. And without a doubt, like you read those descriptions of how caring she was from other people. I don't doubt that she made a lasting impression in her very short time here.
Yeah.
Yeah.
No, definitely. I think that's why I wanted to do this story, because initially I was like, oh, I don't know if I should. And then when I saw it and I just read about who she was as a person and watched a lot of different news clips of other people describing her, I was like, we need to learn from this and hopefully use her story as, an opportunity for everybody else to grow and be better, providers for everybody. So,
Absolutely.
yeah.
Great job. Thanks again, BT.
Aw, thanks, BT. All right. Well, thank you so much, everybody, for listening. If this episode speaks to you and you think it will benefit others from hearing our stories, especially this one, I think this is going to be a big pharmacology review. And now you can go and show up in your rotation being like, I know everything about colchicine. Send this episode to that particular person, but like to everyone else as well.
Yeah.
But this can also help us reach even more people.
It can. The episode will be available on YouTube, Spotify, and Apple Podcasts, or wherever you get your podcast from. You can connect with us both individually, but also follow our page on Instagram. It's helping us grow and give us a lot of visibility with all the follows that we get. All of our handles and how you find us on across all of our SM platforms are going to be linked in the description of this episode. And we love and appreciate the support always from day one. Until next time, don't you forget it. We got this.
We got this. Bye.